Historic investment in Appalachian hospitals, the Big Beautiful Bill impact. A bold new initiative, the Big Beautiful Bill, is set to revolutionize healthcare in Appalachian hospitals, and it's a story that deserves to be told. Scott Cantley, president and CEO of Memorial Health System in Marietta, Ohio, shares his first-hand account of the challenges faced by rural healthcare providers and the potential game-changer this bill represents. In a region where hospitals struggle with chronic underpayment and clinician recruitment, this bill offers a glimmer of hope. While some headlines paint a bleak picture, Cantley argues that this investment is a true public service, one that could transform the healthcare landscape in rural Appalachia. But here's where it gets controversial. Previous federal policies have favored urban health systems, leaving rural hospitals struggling. However, a recent move by the Ohio legislature aims to redirect federal funds to where they're needed most. And this is where our story takes an inspiring turn. Ohio's U.S. Senators, John Husted and Bernie Moreno, stepped up to the plate, demonstrating effective leadership. They fought for changes that will ensure fair compensation for rural hospitals like Memorial Health System, preventing devastating cuts that could have closed hospital doors. Through their efforts, critical provisions were added to the bill, directing record levels of Medicaid and federal funding to these underserved communities. This bill is a historic milestone, and its impact will be felt by every resident in Cantley's community. Every life-saving treatment, every local job secured, and every hospital door remaining open is a testament to the power of this investment. So, while some may argue the merits of this bill, the impact it will have on the lives of those in rural Ohio is undeniable. It's a story of hope, resilience, and the power of effective leadership. What are your thoughts on this initiative? Do you think it will make a difference in rural healthcare? We'd love to hear your opinions in the comments below. Will Trump's $50 billion rural health fund save struggling hospitals? Is Trump's $50 billion allocation for rural healthcare truly sufficient? In a significant move, Congress has earmarked $50 billion specifically for rural hospitals and healthcare providers, aiming to ease concerns regarding the substantial cuts to federal healthcare funding that President Donald Trump enacted on Independence Day. However, the pressing question remains, can this financial aid effectively rescue the beleaguered rural healthcare system? Alan Morgan, the CEO of the National Rural Health Association, a nonprofit organization focused on rural health policy, expressed his uncertainty, stating, "I have more questions than I have answers. No one has those answers yet." He pointed out that the new funding, which is intended to be distributed over 5 years, pales in comparison to the staggering $155 billion in projected cuts to rural Medicaid funding over the next decade, as estimated by KFF, a nonprofit health policy research organization. There is a growing concern among experts, hospital administrators, and lawmakers from both political parties that Trump's legislation could severely impact rural hospitals and clinics, which serve a disproportionately high number of Medicaid patients, those who rely on this federal state health insurance program designed for low-income individuals. The new law proposes to cut over $1 trillion from Medicaid over the next 10 years, a move that critics argue primarily benefits wealthier individuals through tax reductions. The introduction of the $50 billion fund was a strategic effort by Republican leaders in Congress to secure the support of party members who were initially hesitant to endorse such drastic cuts to Medicaid and other health services. In the Senate, this rural health initiative played a crucial role in garnering votes, including that of Alaska's moderate Republican Senator Lisa Murkowski, who voiced her worries about the potential repercussions of the law on healthcare in her state, where approximately 1 in 3 residents is covered by Medicaid. Jared Cozen, the president and CEO of the Alaska Hospital and Healthcare Association, expressed his deep frustration regarding the cuts to Medicaid funding, which he believes will have long-lasting negative effects on Alaskans. He criticized the approach taken by Republicans, suggesting that they avoided exploring viable solutions by merely allocating funds without a comprehensive strategy. It's frustrating in the public realm when decisions like this are made fast and, frankly, carelessly, he remarked. The consequences are going to fall on us, not them. The impact of the law's funding cuts is particularly concentrated in 12 states with significant rural populations that expanded Medicaid under the Affordable Care Act. These states include Illinois, Kentucky, Louisiana, Michigan, Minnesota, Missouri, New York, North Carolina, Ohio, Oklahoma, Pennsylvania, and Virginia. Some Republican lawmakers have celebrated the $50 billion Rural Health Fund as a significant achievement in healthcare policy. However, there remains considerable uncertainty regarding which hospitals, clinics, and providers will benefit from this funding and the extent of the financial support they will receive. Understanding the funding mechanism. The Rural Health Transformation Program is set to distribute $10 billion annually from fiscal years 2026 to 2030. States are required to submit applications for their share of the funding by the end of this year, detailing how they plan to utilize the resources. The law specifies several potential uses for the funds, as outlined by an analysis from the Bipartisan Policy Center. Providing financial support to rural hospitals to sustain essential services, including emergency care and maternity services. Recruiting and training healthcare professionals such as doctors and nurses in rural areas. Enhancing emergency medical services, including ambulances and EMTs. Implementing new technologies, such as telehealth services. Offering treatment for opioid use disorders and mental health services. Improving preventive care and managing chronic diseases. Half of the annual $10 billion will be evenly distributed among states that apply, while the remaining half will be allocated at the discretion of the Federal Centers for Medicare and Medicaid Services, currently led by Dr. Mehmet Oz, based on factors like rural population and healthcare facilities. While this program does not fully compensate for the anticipated losses states will face, Morgan believes it presents an opportunity to rethink the funding structure for rural healthcare. He advocates for greater flexibility in how states can utilize these funds, emphasizing the importance of focusing on preventive care to maintain the health of rural communities while ensuring hospitals remain operational. If done correctly, it could really change the future course for rural America, Morgan stated, though he acknowledged the challenges involved. The states most affected. Kentucky is projected to experience the most significant impact from the reduction in rural Medicaid funding, with an estimated loss of $12 billion over the next decade, according to KFF analysis. The state's Medicaid department is currently awaiting further federal guidance to clarify how these changes will affect its program. Kendra Steele, a spokesperson for the Kentucky Cabinet for Health and Family Services, noted, over 1.4 million Kentuckians rely on Medicaid. This includes half of all children in our state, seniors, and other vulnerable populations. The passage of this federal legislation will have serious implications for these individuals, rural healthcare, hospitals, and local economies. Even with the introduction of the new program, states nationwide will need to reassess their budgets in light of the cuts, according to Hemi Towerson, Executive Director of the National Academy for State Health Policy, a nonpartisan organization that assists states in developing healthcare policies. Every region is slightly different, and there's not a one-size-fits-all approach, she explained. Hospital ownership varies, as do the types of services that are critical for the communities they serve. They must explore innovative ways to deliver these services amid dwindling resources. Currently, approximately 44% of rural hospitals are operating at a loss, a higher percentage compared to the 35% of urban hospitals, according to KFF analysis of RAND hospital data. Rural at heart. Before the bill's passage, Dr. A sought to reassure U.S. House Republicans that even districts not classified as strictly rural could still access funds from the program. Pennsylvania Republican U.S. Representative Rob Bresnahan indicated that financial support would begin flowing to his district as early as next year, having met with Trump, Oz, and others to secure commitments for his area. His district encompasses both suburban and rural regions, including the cities of Scranton and Wilkes-Barre. Despite the legislation providing guidelines for determining which areas qualify as rural, Morgan anticipates a rush among lawmakers and providers to claim rural status to secure funding. That's going to be a huge issue, defining who's rural, he remarked. We're all rural at heart when it comes to money. This situation raises important questions. Will the $50 billion be enough to address the challenges facing rural healthcare? How will states navigate the complexities of funding distribution? What are your thoughts on the effectiveness of this legislation? Share your opinions in the comments below. Ohio hospitals, $1.3 billion win or $6.45 billion loss. Medicaid cuts explained. Here's a shocking truth. while the Ohio Hospital Association is publicly applauding Republican U.S. Senators John Husted and Bernie Moreno for their role in securing funding for rural hospitals, they're staying eerily silent on whether this legislation will ultimately cost their member hospitals billions. But here's where it gets controversial. Outside experts are sounding the alarm that both rural and urban hospitals could lose billions under the same bill. So, what's really going on here? The legislation in question, President Donald Trump's One Big Beautiful Bill Act, signed on July 4, promises a staggering $1 trillion in tax cuts to the wealthiest 1% of Americans over a decade. Sounds generous, right? But there's a catch: it also adds $3.4 trillion to the national deficit. And this is the part most people miss. To offset this deficit, the bill slashes over $1 trillion from Medicaid, a move that could leave millions without health care. According to the Nonpartisan Congressional Budget Office, CBO, these cuts, combined with reductions to the Affordable Care Act's insurance exchanges, will leave an estimated 10 million more Americans uninsured by 2034. In Ohio alone, 440,000 people could lose their insurance. That's not just a number, it's families, neighbors, and friends who may no longer have access to affordable care. Ohio's hospitals are already struggling. In May, the Ohio Hospital Association reported that half of the state's hospitals, and a staggering 72% of rural hospitals, have been operating at a loss since 2022. Emergency departments, which are legally required to treat everyone, regardless of their ability to pay, are bracing for a wave of uninsured patients. This could mean longer wait times and even staff cuts, as hospitals struggle to keep their doors open. Despite these dire warnings, Ohio's hospitals and their industry group have chosen not to fight the legislation or criticize the senators who supported it. Instead, for rural hospital chains, Memorial Health, Genesis Healthcare, Adena Health, and Southern Ohio Medical Center, sent a glowing letter to Husted and Moreno, thanking them for securing $50 billion in funding for rural hospitals over the next 5 years. "Your leadership made a clear difference," they wrote, praising the senators for helping to sustain essential services and local jobs. But here's the twist. While the senators claim this funding will provide Ohio's rural hospitals with $1.3 billion over 5 years, health policy experts at KFF warn that much of this money could end up in urban and suburban facilities instead. Worse, the American Hospital Association estimates that Ohio's rural hospitals will still lose $2.5 billion in Medicaid funding over the next decade, nearly double the amount the senators claim to have secured. Here's the real question: are Ohio's hospitals and their association praising the senators while quietly knowing they're losing out in the long run? The Ohio Hospital Association refuses to comment on whether their members will gain or lose under this bill. Their spokesman, John Palmer, simply reiterated gratitude for the provisions supporting rural hospitals and extending Ohio's Medicaid supplemental payment program through 2028. Matthew Perry, CEO of Genesis Healthcare System, argues that the bill allows Ohio to leverage more federal dollars through a provider tax. But even he acknowledges that the reductions in provider taxes kick in after 2028, gradually decreasing over time. Meanwhile, KFF's analysis highlights the uncertainty around how the $50 billion Rural Health Fund will be distributed. Half of it is still up in the air, awaiting decisions from federal agencies. And let's not forget the bigger picture. The $50 billion supplement is temporary, while the Medicaid cuts are permanent. Add to that the 10 million Americans projected to lose insurance, and you've got a recipe for overcrowded emergency rooms, and even more financial strain on hospitals. So, what do you think? Are Ohio's hospitals genuinely benefiting from this legislation, or are they being shortchanged? Is praising the senators a strategic move, or a genuine expression of gratitude? Let us know in the comments. This is one debate that's far from over.